And for more insight on the fight against Ebola, I'm joined now by Mead Over. He's a senior fellow at the Center for Global Development here in Washington, D.C. Welcome back to the show.
Nice to be back.
We're seeing Ebola now in a major U.S. city, New York City. Lagos, Nigeria, the most populous city in Africa, is now Ebola-free. So what can New York perhaps learn from Nigeria?
So I think that's a false comparison. First of all, I don't believe this Ebola-free thing. Every single day, every week is a roll of the dice. We could have a case tomorrow in Boulder, Colorado, or a case in Miami, and a case again in Nigeria. So really, until this epidemic is completely controlled at the point of origin, there's no such thing as Ebola-free.
I want to turn now to these two Texas nurses that treated that man in Dallas. Both are apparently Ebola-free, or there are no signs of the virus in their body. And Nina Pham met with the U.S. president. We saw photos of that meeting taking place. A little PR, perhaps, on part of the U.S. government of seeing her hugging the president. It's okay now. It's not as bad as people think.
So this
removing the stigma, perhaps?
Absolutely. So Ebola-free is a perfectly appropriate term to use for an individual once they have been cured of the disease. And so this is wonderful news. I think all of us are feeling wonderful that Nina Pham has survived. That takes me back, though, to the time when there was a lot of stigma about HIV in the United States and around the world. And in fact, national leaders, including presidents of the United States, made very positive steps exactly by hugging people with HIV. So this is an important symbol and an important public health message that people who have survived Ebola are in fact Ebola-free and should be hugged.
I want to ask your opinion on this new development coming out of the EU, this huge announcement of about $1 billion being put forth toward the fight. The World Health Organization had said it would take about $1 billion to really fight the disease. I want to get your thoughts on that.
So I'm really glad that the international donor community is really stepping up to the plate here and providing these resources. But you know, providing the money is only the first step. After that, we have to disperse that money. We have to spend it in productive ways. And I think that's the part that's so difficult. And right now, it's increasingly looking like we need to have more health workers on the ground. We need to have heroes like Craig Spencer, who went over there and risked getting infected himself. There are dozens, hundreds even, of people working as volunteers now, but we need perhaps thousands more.
Two questions. Will that money get to where it's needed? Will it get to the front lines? And the second part about volunteers, like you mentioned, Dr. Spencer, has there been a decrease in volunteers? Are there issues with getting people to volunteer to go down there and fight Ebola?
So, of course there are. I mean, think of yourself. Would you want to volunteer even if you had the medical training? Whether you're likely to volunteer is going to depend on whether you think you can leave if you need to. For example, if you're exposed. So these travel bans that have been threatened by some parts of the American political spectrum are really dangerous to the African countries that need to fight this epidemic and need people to be able to come in and out freely to help them. And therefore, those travel bans are dangerous to the United States. So yes, it's a very important thing.
What about these vaccines that are being rushed out? We're hearing about trials starting in December, thousands of doses available by January. Is it too soon? Are there any risks that people should be concerned about with getting something so fast out there?
Well, there certainly are, and the discussions about exactly how to roll those vaccines out are exactly about this issue. It would be wonderful if we could magically produce a vaccine that was guaranteed to work, but unfortunately we won't know whether it works until we conduct rigorous randomized controlled trials. And the ethics of those trials are something that have to be carefully thought about, but we need solid information that these vaccines work. So the pressure is to produce that information fast enough so that we can really start to help people soon.
All right, Mead Over, we appreciate your time and your insight. Thank you so much for joining us.
Thank you, Elaine.